Renal failure and dialysis. Kidney failure or renal failure occurs when the kidneys fail to function adequately. Kidney failure is normally classified as either acute or chronic. Acute renal failure occurs when a rapid or sudden loss of renal function results in poor urine production, electrolyte disturbance, and fluid balance disturbances. It, the main reason and causes is decreased blood flow to the kidneys, trauma, a tissue injury that occurs more or less suddenly due to a violence or accident, cardiac failure, surgery, shock, or urinary tract obstruction. Chronic renal failure, which includes the chronic kidney disease, occurs when a progressive loss of kidney function occurs over a period of months to years, also known as end stage renal disease or ESRD. The causes is diabetes, known as renalopathy, hypertension, too much pressure pushing through the pipes for too long, polycystic kidney disease. Complications include pulmonary edema, a condition caused by too much fluid in the lungs, cardiac stagnation, abnormal or irregular heartbeat, congestive heart failure, hypertension, liver failure, uremia, a buildup of toxins in the blood. It occurs when the kidneys stop filtering toxins out through the urine. The signs and symptoms: abdominal, pelvic or flank pain, pain on the side of the back just below the rib cage and above the waist, hematuria, loss of blood in the urine, edema, decreased urine output or cessation of urination, hypertension, anorexia, an eating disorder and a serious mental health condition, tachycardia, a heart rate over 100 beats per minute. Treatment include dialysis. Dialysis is an artificial process used to remove water and waste substances from the blood when the kidneys fail to function properly. It generally works through osmosis and filtration of fluid across the semi-permeable membrane with the use of dialysate. This is the peritoneal dialysis methodology. These figures explain you detailed way of how the blood in tubing flows through the dialysis fluid. The principle behind this dialysis is it works on the principles of the diffusion of solutes and a ultrafiltration of fluid across a semi-permeable membrane. Diffusion describes a property of substances in water. Substances in water tend to move from an area of high concentration to an area of low concentration. Blood flows by one side of a semi-permeable membrane. A dialysate or a special dialysis fluid flows up by the opposite side. Types of dialysis include hemodialysis (HD), peritoneal dialysis (PD). Each removes waste and excess water from the blood in different ways. In hemodialysis, it is a medical procedure designed to support the lost functions of the kidneys. It removes the buildup of toxins that occurs when the kidneys can no longer filter these toxins out. Hemodialysis is the type of dialysis in which blood is extracted from the body and sent through a machine called a dialyzer. On the other hand, peritoneal dialysis is done in the home or a extended care facility when dialysate fluid is introduced into the interface. Waste and water are removed from the blood inside the body using the peritoneal membrane as a natural semi-permeable membrane. In this slide was prepared by Mr. Sheshatri, PGDMLT student